So I'm going through my Instagram feed and I come across this post by Dr. Subio, who I respect, I think is awesome. And it's about marionette lines, and his results are amazing. And this is very artfully done. And this particular patient can have filler placed right in here. But there's a problem with this post. The problem that I have with this post is that people who are not in aesthetics, patients, will see this and come in and they will be asking for filler right here, like Dr. Subio did right in here. And I'm telling you that this technique is only going to work for some people. And those some people are typically young people who have this shadowing and this marionette line structurally, but the rest of their face looks very youthful and they have a nice strong jawline and an oval face. If you have someone who's older, like in this example, if I went and put filler right into here, it would make her lower face look heavier and more square, which reads older, and it also reads more masculine. And that is like the worst thing you could do to an older lady, is to make her look more like a man, because as we age, we naturally start to look a little bit more masculine. The last thing I want to do is increase the heaviness in that lower half of the face. Or this lady here, if she came in, I could probably put a little bit of filler just in this line, but I cannot correct that line completely with filler and keep her looking good. Marionette lines are multifactorial. That means that there's lots of reasons that you get this shadowing. And as we age, we tend to shrink. Our entire skull shrinks. This part of our face tends to shrink disproportionately more than the rest of the skull. We also have changes in the skin. You know, if you imagine a balloon that's slowly being deflated, the overlying skin is sort of doing this. So you have changes in skin quality and texture and elasticity. The skull is shrinking, and this part, the chin, is sort of shrinking more than the rest of the face, and you get this going on. So if you just put filler here in every patient, it's not going to work. So I hope that explains why one syringe of filler won't always deal with marionette lines, and we have to address some of these other issues as well. Everything you see on the internet, take with a grain of salt, and understand that you need to work with a professional who does this day in and day out and is very aware of the subtleties of aesthetic medicine, and that looking good, looking refreshed may not mean that that particular line is erased. It may mean addressing the entire face, and that we always honor normal anatomy.